The unique demands and issues facing Asian Americans' health was the focus of a recent roundtable hosted by the county's Asian American Health Initiative. The event brought together the federal government's Office of Minority Health and the county's Department of Health and Human Services to foster dialogue about the most pressing health issues facing Asian Americans. Among the top priorities at the federal level are opioid abuse, viral hepatitis, and workforce development. Opioid abuse is a growing concern among Asian Americans, but for reasons that differ from other demographics.
With the Asian American community, if you look at what generally is the case, is that a lot of the kids feel a great high achievement bar, and with that comes issues of anxiety and depression. And so some of the drug use factors are that, and also the stigma of sharing that. You know, it looks weak, it's considered a failure. And so they tend to hide. They don't have ways to compensate or cope with that high stress.
Locally, Montgomery County's Department of Health and Human Services has created an equity value framework to better target the residents they serve, including Asian Americans. For example, the county has altered its language in contracts to more specifically recruit vendors who can meet the unique needs of Asians.
The target service population need to be proportionate to that population in the county. If we add those language in the service contract, it makes the contract more reflective and responsive to the community.
Research shows healthcare access and quality are only partially responsible for one's health. Instead, other socioeconomic factors contribute more greatly to one's overall health.
The health care disparity is only about 20% of health care. The other 80% is where you live, what you're educated, what job you have, and your family, and your normal daily activities.
According to the Asian American Health Initiative, Asians make up 13% of the county's residents. In Gaithersburg, I'm Crystal Park.